Good morning. Wow, that was an easy way to get people to stop talking. As people start trickling in, let's go ahead and get started. Good morning and welcome to the 2025 Shape of the Region Conference. I'm Bob Kipps, Managing Director at Kipps DeSanto and fortunate Chair of the Board of the Community Foundation for Northern Virginia. I appreciate you being here today. This marks the 8th annual conference hosted by the Community Foundation, and we are honored to be one of 17 regional partner organizations co-hosting today's event. Each year, as you know, this conference brings together us to address some of the most pressing issues facing our community. As chair of the Community Foundation, I've had the fortunate position to see firsthand how this organization, CFNOVA, serves as a broad-based funder, a trusted advisor for charitable investments, and a convener like this, a convener for our region's most tricky and pressing issues. I'd like to start today by asking my fellow board members, current and past, to stand to be recognized for your volunteerism and support. Thank you. This year, we are returning to our very first data-driven report from 2010, which focused on the region's youth. Now, 15 years later, those children are young adults navigating an entirely new set of challenges. By revisiting this study, we can assess what has changed, what remains the same, and how we can better support the next generation. With health and safety dominating national and local conversations, this timely discussion will provide key insights how our region can respond and thrive. I'm now pleased to welcome Drew Wilder, NBC4 Northern Virginia reporter and today's event host. Drew? Thank you.
All right. Good morning, everybody. Thank you, Bob. I want to thank the team at Valo Park and everybody for having us out today. This is a beautiful space. This is my first time in this building, and it's striking, gorgeous with that light coming in. Beautiful room. So thank you so much for coming out here today. I'm a Northern Virginia reporter for NBC4. I also anchor most Sunday nights, and I believe this is my 4th year hosting the Shape of the Region Conference. This is always a really great event. I'm always very honored and proud to do it, and always excited to see everybody that turns out. So whether you are joining us in person this year here at Valo Park or joining us virtually via Zoom, we are welcoming hundreds of guests to the 8th annual Shape of the Region Conference today, hosted by the Community Foundation for Northern Virginia. So this year's event, as Bob mentioned, is called Our Children, Creating Safe and Supportive Futures for Northern Virginia's Youth. And as we get together today, we're going to discuss some pressing issues facing our region, and it is impossible to overlook the profound challenges impacting our youth. And we've got a lot of data today. We've also got some really, I think, impactful statements from actual members of our youth. So that's going to be a really important voice to include in today's discussion. According to the 2023 Virginia Health Survey, 13.2% of students reported missing school because they felt unsafe. 13.2 students reported missing school because they felt unsafe. And 17% of Virginia high school students say they experienced bullying on school property. Even more tragically, death by suicide has become the 2nd leading cause of death among children aged 10 to 14. These troubling statistics are not just numbers, they reflect our reality that undermines the well-being of our young people, hindering their academic potential and their ability to thrive in the workforce. In turn, this has a direct impact on their economic mobility and the future prosperity of our entire region. Today, we engage in these critical conversations, but let us keep in mind the urgency of addressing these challenges and the role we each play in building a healthier, safer, and more supportive environment for our youth. Today, the Community Foundation is joined by 17 regional partners. You can see them all up here on the screen. These partners represent all sectors of the Northern Virginia region: business, philanthropy, education, and government, highlighting how this work impacts every facet of our community. Thank you to each of our organizational partners today. Please join me in thanking the 2025 Shape of the Region sponsors who have made today's event possible. Our community sponsor today, Bank of America, represented by Ashish Khosla, CFNOVA board member. Our engagement sponsors, American Psychiatric Association Foundation, Frank and Betty Wright Foundation, Innova, and Potomac Health Foundation. I'd also like to recognize the elected and appointed officials and the representatives who have joined us here today: Jacqueline Marmol, Office of U.S. Senator Mark Warner; Holly Siebold, Virginia Delegate for the 35th District; Brianna Sewell, Virginia Delegate for the 25th District; the Honorable Thomas P. Sotelo, District Court Judge for the 19th Judicial District's Juvenile and Domestic Relations District Court in Fairfax; Matt DeFerranti, Arlington County Board Vice Chair; Julie Briskman, Loudoun County Board of Supervisors; Susan Cunningham, Arlington County Board of Supervisors; Matthew Savage, Office of Providence District Supervisor Dahlia Palchik; Debbie Hiscott, City of Falls Church Vice Mayor; Nalia Alam, Herndon Town Council Member; John Taylor Chapman, Alexandria City Council Member; Mary Beth Connolly, City of Falls Church Council Member; Jacinta Green, Alexandria City Council Member; Michael T. Lloyd, Herndon Town Council Member; Melanie K. Wyatt, Superintendent of Alexandria City Public Schools; and all of the former elected and appointed officials. If you would all please stand up right now and let us say thank you for your participation in this conversation. So when we were preparing for this event, as I mentioned, we talked with some middle school age students and some high school age students, because we have this data and that shows us a lot of important things, but it don't really get a feel for that on numbers and on a piece of paper. So we wanted to hear from kids who are living this. And my wife and I are relatively new parents. We have a almost 3-year-old and a 6-month-old, so that one's really new. And as any other parent in here knows, that is always a learning curve. Every day it's like, oh, wow, that's a thing now that we've got to figure out. But as we were having these conversations with these young people, it was really eye-opening to me being at this stage in my life, because I felt like I was getting a peek into the future. And I know that our world is going to change so much, before my daughter and my son hit those age ranges. But it was so eye-opening to me to hear from them opening up about their experiences and the things that they encounter at home, at the bus stop, on their way to school, in school, on social media. It was really eye-opening. It was a little bit scary, but it was also hopeful in a lot of senses, because the kids who are in our community, that are going to our schools, that are participating in our lives, in our churches, in our sports activities, they want to be part of what we're all trying to be part of here today too. So I'm excited for you to hear some of the conversations that we have, because I think there's a lot to take away from that. So as we mentioned, we've brought together the community leaders, the various professional backgrounds to participate in this conversation, and now we want to hear from those kids I mentioned. We've got a couple of videos that we're going to play. The first one, we were trying to really hear some of their stories, hear where these tension points are in their lives. Where are they experiencing bullying? Where are they experiencing some of these issues that are impacting their lives? So we'll take a couple minutes here and listen to what they had to say. Do I need to hit a button? Maybe I'm currently hitting a button with this. I promise it played when I sent it at like 8:30 last night.
That's right.
I guess the most unsafe area is kind of online.
It's kind of like someone commenting on someone's video.
Talking bad about people behind their backs, or they just hate someone just because they don't like them or for some reason.
If it's you doing well in a sport, or literally, or you dancing, or literally anything, it can just make you feel like you want to quit.
Do you think that expresses itself? Do those people seem affected by that?
Some people do seem affected by it because some people just go way over the line.
People like made them so sad or so upset that they don't want to go to school the next day.
I do see bullying sometimes. Like, I have a brother with autism, and there was an incident where he was getting bullied.
That had to feel terrible. It had to make you feel terrible.
It really made me feel terrible because he can't advocate for himself.
I feel like people in my generation are kind of afraid to be emotionally vulnerable. So when we discuss things such as bigotry, it's almost like, oh, this kind of thing happened to me, but I'm kind of expecting this by now. There's no opportunity to really digest or to comprehend what happened or communicate that to anybody. People are afraid to talk outwardly about it because they're afraid of afraid of any judgment, afraid of the reality that maybe they didn't do anything in response. They kind of just had to take it.
There's a lot of struggles, I mean, particularly for like teen girls on the internet. There's like a lot of maybe men who take it upon themselves to contact you, or generally, yeah, just like DM you or whatever. So I know I and a lot of my friends have dealt with that.
I know plenty of my friends have actually completely gotten off of social media because of strangers that are trying to like contact them.
I definitely have a story on something that occurred actually with one of my friends. So there was this photo taken of her and posted on a platform known as TikTok, and she asked the individual to take it down like very like kindly. And like this issue just started happening between them, and a lot of people were more on the other individual's side. So she was getting a lot of like attacks, getting text messages like why do you care so much and stuff like that. But like it got to the point where like she just didn't want to come to school anymore because she felt like she would be constantly attacked everywhere she went, because it elevated from something more from being online to being actually in person.
I guess the most
Oop. Check. Oh, hi. Wow. If you weren't awake yet. I thought that last point was maybe the most critical, in that it transitioned from being something online to being something that was impacting real life. And that impact was feeling isolated, feeling embarrassed, feeling ashamed, and feeling like you couldn't show up to your own school the next day. As we kind of carry some of these feelings into the conversation, I do think it's important to throw in, I don't want to call it a caveat, but maybe something positive, in that every single one of these students also said, while they are experiencing a lot of, or their friends might be experiencing some negative impacts of social media, some negative feelings that come from being online, they all applauded their schools for getting cell phones to some degree, or to in their entirety out of the classroom. And they say that has improved some of that social media bullying, some of that online bullying significantly. So that is something to take away, where again, some of the folks in this room, some of our policymakers were able to actually create some change that, according to these kids, is paying real dividends for them. Now it's my pleasure to welcome Dr. Denise Bellows, who will be presenting a portrait on Northern Virginia's youth. Denise is a senior director of Insight Region, the Community Foundation's premier data and research center. In her role, Denise collects and analyzes data, sharing key findings and reports shared on the Insight Region website and at community events like today's conference. Denise also supports internal data collection and analysis strategies that support the Community Foundation's grant marketing and community leadership operations. Prior to joining the Community Foundation, Denise spent 8 years leading research and program evaluation as a contractor for various federal health agencies, state governments, and non-government organizations at Insight Policy Research and the National Opinion Research Center. Her research on health resources and service supports to vulnerable populations is published in Progress in Community Health Partnerships, the Journal of American College Health, and the Journal of Community Psychology. Denise, welcome.
Thank you, Drew. And good morning, everyone. Thanks for being here today. I'm honored to be here at my second Shape of the Region event. I got a lot of data that was explored in the 2010 report and in our recent research on this topic. So today I'll just share a few key findings with you to inform the discussion with our panelists later today. So who are today's youth? We heard a little bit already, but for some context, they were born in the 2000s. They probably don't remember a time before smartphones and the internet, the ability to get anything they want delivered to their doorstep. They're living through the information age with 24/7 access to news and people from all over the world. The online gaming industry has boomed in their lifetime. Their parents are millennials or Generation X, and they are known as Generation Z or Generation Alpha. So our youth make up about 25% of the 2.5 million residents of Northern Virginia. That's over 630,000 youth aged 0 to 19. It's 100,000 more than in our last report. So that population has increased about 25%. However, the rate of growth is slow compared to what it was in earlier times. Compared to a decade ago, we have fewer children under 9 in this region, and that slowed growth can't be explained by declining birth rates alone. Our generation of youth today is very diverse in Northern Virginia. Over the past decade, the biggest growth is in youth who identify as multiracial or multi-ethnic. Similar to 2010, half of our youth live with at least one immigrant parent. That's more than double the rate in the state of Virginia and the United States. So for economic and social circumstances, the share of youth in Northern Virginia in extreme poverty is actually pretty low. It's remained at about 5 or 6%. Extreme poverty meaning for a family of 4, household income of $30,000 or less. Since our last report, we have 12,000 fewer families that are very low income, making between $30,000 and $60,000 a year. But $60,000 for a family of 4 is not enough to get by in Northern Virginia. To understand what is enough to get by, the United Way created the ALICE Index. ALICE stands for Asset Limited, Income Constrained, and Employed. They look at a survival budget, and they base it on a specific geographic location, so we can look at the survival budget within Northern Virginia. That's $120,000 per year for a family of 4, or 400% of the federal poverty line. So after some steady decline in the number of families that are in that ALICE, making less than that ALICE amount in Northern Virginia, we've had an increase in recent years of about 20%. So currently about 24% of families are making less than that ALICE threshold for a family of 4. Last year, there were 27,000 children in Northern Virginia who reported food insecurity. And since 2010, we've had a decrease in children living in homeless families, so down to 660 children currently living in homeless families. And recent unemployment is another factor that can negatively impact child development, even future employment opportunities for our youth. So as in 2010, what's remained consistent, about 57% of Northern Virginians obtain a bachelor's degree or higher. They also have higher than average achievement in their reading and math standards of learning exams, with few exceptions within Northern Virginia for some jurisdictions. One thing that is different a little bit is the growth of the percent of Northern Virginians with a bachelor's degree or higher. It's increased in Virginia and the United States, but it has remained consistent in Northern Virginia when we compare to the past decade. All right, so now that we have some context, some social and economic context, let's talk about the health and safety of youth and what we've learned about Northern Virginians. So about 1/3 of middle schoolers and 1 in 10 high schoolers say that they don't feel safe on their way to school or at school. And this is Girls and Hispanic and Latino students report this at a disproportionate rate than other students. We've seen an increase over the years in the number of schools who have school resource officers. School resource officers, or SROs, have a role of maintaining safety and security in schools, and they also provide some youth mentorship. So of the students who have a school resource officer at the school, many of them have a very favorable view, more than 75% that say they feel safer with that SRO there. And of the about 30% of schools who don't have an SRO, students and teachers say that they would feel safer if they had one. So though bullying remains, if you look at bullying overall, it's consistently about half the rate in Northern Virginia as it is in the rest of the state. So that's good if we talk about in-school bullying or in-person bullying. But when we look specifically at electronic bullying, that's not so much the case. And in some cases, electronic bullying is more frequent in Northern Virginia than it is in the rest of the state. Electronic bullying has increased by about 30% over the past 10 years. It's reported by 20% of middle school students and 10% of high school students. More alarmingly, I guess I found, so about 20%, or 1 in 5 8th through 12th graders believe I have the right to say anything I want online, even if what I say hurts someone or violates someone's privacy. I think we heard a little bit of that from our video of students earlier too, that this is a challenge that they face. Over the last 2 years, youth overdose deaths have increased 43%. Children, some of those overdose deaths in children are related to them finding substances in the home. And a quarter of children under the age of 14 have witnessed an overdose death. Youth represent 15% of opioid deaths. That's about 255 youth in recent years. Nationally, youth represent 7% of overdose deaths. So it is, we have a disproportionate number of youth overdosing in Northern Virginia versus the rest of the country. Most of these overdose deaths are fentanyl related. The Virginia Department of Health has actually acknowledged that parts of Northern Virginia have high needs for opioid support and related outcomes. Finally, youth deaths by suicide also increased 45% since 2010. So the rate of suicide deaths among youth is still far below the national rate, but the trend is still concerning. Most of these suicide deaths are firearm related. If we look at all firearm deaths in Northern Virginia, most of them are suicides, not homicides. 988 is the National Suicide and Crisis Support Lifeline. Youth can call, text, or chat that number to receive support. Recent studies of the 988 number have found evidence that youth who text or chat find greater success in receiving support that they need with this hotline. So many of these health and safety data that I covered today did not exist in 2010. We weren't necessarily collecting as much information about opioids specifically or electronic bullying, which is why I think it's great we have the opportunity to talk about them a little bit more today. We have a unique opportunity to focus on Northern Virginia's youth and discuss opportunities for support. So in review, to prepare for our discussions, we had about 30% of middle schoolers who feel unsafe. Girls and Hispanic Latino youth report feeling safe more than other groups. For bullying, electronic bullying has increased 30% among middle school students. 20% of middle school students and 10% of high school students report electronic bullying. 15% of all overdose deaths are among youth under age 25, and overdose deaths have increased 43% from 2022 to 2023. And deaths by suicide have increased 45% since our 2010 report. Majority of them were firearm related. So what I presented here today is just the tip of the iceberg. We covered a lot of data, and more of it is in the report that's in front of you that you've been handed when you walked in. And if you're online, you can see the report at our website. There's a link to it in the online version of the report. Today, our panelists will shed some light on these issues and talk about some innovative solutions to support youth in Northern Virginia. Please don't hesitate to reach out if you have questions about what I've shared today. You can email me at the address on the screen, and I look forward to the discussion with our esteemed panelists. Thank you.
You know that well. You didn't use a single note in here. Oh, sorry. No, don't apologize. That's really impressive. I'm on TV. I need scripts. That was fantastic, by the way. Well presented, impactful information, and makes a lot of sense that a lot of that data is new because the way of our lives have changed so much in the last 10 years, and certainly likely to change that much over the next 10 to 15 years. So the information that was just shared today not only sheds a light on our challenges for young people, but also empowers us, like we talked about earlier, to act and try to make some real changes, real differences in their lives to make this community better for them and for their children one day. So thank you for that contribution to that important conversation. And next on our agenda is the fireside chat. Please help me welcome to the stage our moderator, Sage Bolte, and speakers Mark Shriver, Melanie K. Wyatt, Raul Andrews, and Greg Washington.
Good morning, everyone. Thank you, Drew. And thank you, first of all, to the Community Foundation for Northern Virginia for being willing to be bold and shine a light on such an important topic. We are grateful for your leadership in this area. And thank you all for being here today with us to talk about such an important topic. I'm Dr. Sage Bolte. I have the great privilege of being the Chief Philanthropy Officer at CFNOVA, as well as the Acting President for the Behavioral Health Service Line. So I am thick in the midst of it right now. I'm also raising 2 kids in Fairfax County Public Schools. I have a 14-year-old daughter who's in 8th grade and a 16-year-old son who is a junior. And so I'm watching the difference, just the gender disparities as well, between my daughter and son related to social media and the challenges they get pulled into every day. And I'm curious, just for our panel here, how many of you are currently in the thick of raising kids these ages? Yeah. Welcome to the club. I'm looking forward to a really engaging conversation and honored to be moderating this first fireside chat. I'm going to give you a couple business items, and then we'll get right into speaking. Again, I'm going to give them each an opportunity to introduce themselves, but we will have time also to have questions. So if you have questions, please scan the QR code on the screen, or you can visit pollev.com/CFNOVA, or text the word, I think that's / CFNOVA to 22333. So that's up on the screen here. Again, the questions will come up and be pulled up into this fancy computer here that I'll be able to read to our panelists. So I'm going to ask that each of you please introduce yourself, the work you do, and in your current role, how you or the people you are working with are leading some initiatives to address the health and safety of children and our youth in our community. And Raul, I'm going to start with you.
Good morning, Sage. Good morning, champions out in the audience, and certainly want to thank Renee and her team for the invitation to contribute. Raul Andrews, I'm the Executive Director of the American Psychiatric Association Foundation. We are the philanthropic and public education arm of the American Psychiatric Association, which is the oldest medical society in the United States and the largest body of psychiatric workforce in the world. It is a challenge, but a bold initiative at the APA Foundation, Sage, to promote the health and well-being of individuals and communities where we live, learn, work, worship, and play. And we use a three-legged stool for those 5 pillars, and that is the APA Foundation as a thought leader. We bring to the table over 39,000 physicians, psychiatrists. All of our members have been to medical school and then specialized in mental or behavioral health or substance use disorders. In addition to that, we run the largest pipeline program for med students and residents in the world. Almost 1,000 med students and residents across North America and 19 countries around the world who are getting added resources in addition to what the systems do for them, like INOVA. And then finally, we use a thought leadership gene. I think our superpower in the foundation is when we've invited people like Dr. Kay Wyatt, among others, to come out and share real-time insights, they come. And then we'll spend probably $2.5–3 million this year on micro grants in and around communities. And while we don't have the endowment to underwrite whole programs, you would be surprised what $5,000 or $10,000 of largely unrestricted funds can do for community-based nonprofits across the country. So I'll talk a little more as we get, but that's the brief intro of me and the foundation, Sage.
Thank you so much. Dr. Kay Wyatt, same question.
Thank you. First, it's an honor to be here today to talk about something that is very important to me and my community. I am the superintendent of Alexandria City Public Schools, very proud to serve in that role, but also very challenged as we have to navigate a very different platform. I think if I were sitting here a few months back, I would probably have a different perspective and a different lens on some of the challenges we're facing. And as you can imagine, the very diverse community that I serve now in Alexandria has made this work a little bit more challenging. But what I can say is that I'm an advocate for our students, making sure that they feel welcomed and included in everything that we do in public education. So first of all, I want to thank, I know I have a number of Alexandria residents here. Thank you for your support and the great work that we do for our students. I want to make sure that everyone is aware as we sit here today, the world is different. The world is different for our students. The world is different for our families. So as we engage today, I want us to reflect on that because we all sit in different seats, but we all can be advocates, whether it's collectively or independently. And of course, I would speak to that a little bit more. But I think what's most important now is that we have a social emotional literacy around what we do and how we communicate and have a clear understanding of what that means for our world today, for our families and our students, because they bring very different experiences and challenges to the table. So again, thank you for being here.
Thank you. And Mr. Shriver.
Thank you, Sage, and good morning, everyone. I am Mark Shriver, and I'm from Montgomery County, Maryland. I don't know if I'm in the wrong room.
It's like on the other side of the ocean.
I know there's because I grew up in Montgomery County, and my father was from Maryland, and going over the American Legion Bridge was very nerve-wracking. When I came over it this morning, you're not laughing. But when I came over it this morning, it's good to be in Virginia, I guess.
We're very welcoming.
Yes, you are, and the coffee was hot. And I run a high school in Montgomery County. We send students to George Mason, so that's why I'm being extra nice to this gentleman. But I just want to, I guess my background, Sage, and want to thank the Community Foundation for including me, all kidding aside. I was in elected office. I now run a high school. I was in elected office in Maryland in the state legislature. I run a high school now in Montgomery County that works with first-generation kids going not only to high school, but the goal is to get them to and through college. And I ran a nonprofit, Save the Children's Work here in the United States that focused on early childhood education. So I've got a little bit of background in the elected field and the nonprofit management and the for-profit as well. And a bunch of the ideas that have already been discussed here today are super exciting. I can't wait for the conversation. Thanks again for including me.
Wonderful. Thank you. Dr. Washington.
Well, first and foremost, good morning, everyone. Thank you all for coming out today. I am ecstatic to be here. My name is Gregory Washington. I lead Virginia's largest and most diverse public institution with more than 40,000 students, and things at George Mason are going extraordinarily well. I want to say first and foremost, thank you to all of you. Thank you to, I don't know where Denise is, Bellows, but thank you for leading with facts. Thank you for bringing forward that information in that way. Facts is facts, and truth is truth, no matter who's saying it. And I understand where I'm sitting today, and so as irritating as it may be, even Cowboys fans can be right when they lead with facts. And so, look, relative to the issue and the topic of today, gun violence in particular is something that we've been interested in. We've had a couple of students to take their own lives, death by suicide using firearms. And that is what kind of honed me in on it as a president, and I coupled with my my partner in crime on the other side of the river there, Darryl Pines, who I've known for 30 years, and we put together an initiative. We brought our faculty together because what do academics do? We think. And we help produce new knowledge and policy. We brought together more than 100 faculty from the University of Maryland and from George Mason to really focus in on this topic. And so at some point in time today, I can share some of the outcomes of that. And so we focused there. And then we also focused on what I think will be a growing problem for all youth, not just those at universities, but those in the K-12 space as well. And that is the growing problem of mental health. We are seeing significant increases in mental health needs of our students, no matter who they are and where they sit. And I believe you're also going to see that in the K-12 space, because oftentimes young people are coming to us as freshmen with significant needs. And so they didn't just develop those needs over the summer. They had those needs when they were in the K-12 space. And so just great to be here and look forward to the conversation.
Thank you so much. You know, I reflect on even just having witnessed the difference that COVID made in the development and social emotional of these kids, and the catch up that many of them are playing, or the behind that isn't catching up that many of them are experiencing. And while I wonder, just from a big picture, the national and regional challenges, what are the biggest challenges facing youth across the country and in Northern Virginia when it comes to mental health, safety, and substance use? And I'm going to pivot on another question after you address that.
Well, believe it or not, Sage, the biggest problem is still awareness, even though awareness is higher today than it's ever been in the history of humankind. And unfortunately, it did take the COVID pandemic for people to realize that we need to start prioritizing our mental health in the same ways we prioritize our physical health. We haven't done that at any level. And so one of the things I think Denise's research showed, and the video, because of the generational challenges, people living longer but unhealthier, that the younger generations are willing to talk about their mental health challenges. The older generations are unwilling to listen. And I will say that awareness piece hit me in my front porch about 2 years ago, because my son suffered a catastrophic sports injury. He basically broke his entire left hand and only had 3 fingers on his right hand. So he left his game room and retreated to his bedroom. I'm like, fine, you know, Netflix and chill, right? What I did not know is over the course of about 14, 15 months, he was running cryptic searches about how to kill yourself without pain, while I was running around all over the country telling people there is no health without mental health. And I do believe that. But it didn't hit me as hard until I had to face the reality that my son was struggling and begging everybody in my family, don't tell dad. You know, I mean, I don't know what he's going to think about me. I don't know what he's going to think of me. So I think our inability to communicate with children and young adults who are ready for conversation is a problem. The other issue is, and we talked about guns, and we have to lock up our guns, but I don't know when Denise put up the opioid stats and seeing death by suicide, there are things called dirty cocktails. And what we think is happening is that while our children may not be drinking enough water, they got these big Powerades and Monsters and whatever. We don't know that they're spiking those drinks with over-the-counter drugs, so they may not be able to get their hands on a gun. But they can get their hands on Benadryl and NyQuil and all that, and they don't have to go to CVS or Walgreens. They go right in the counter right next door to the refrigerator. The last piece, my school team is here, Kate Berg and Jerry Thuku, and what they have shared with me is what's happening with social media tools. And so we saw a little bit on the tape about DMs, but because my son is an elite athlete, you know, one of the things we don't understand, Sage, the game or the play never ends if you have a bad outing, because people aren't just in your DMs trying to entice you. They're in your DMs trying to humiliate you because you really messed up the bed with your poor performance. And think about these athletes in, you know, March Madness, the name itself. So, you know, I think social media, this awareness thing, and then our inability to just monitor our environments so that we can have courageous communications. And so we use what we call a Notice, Talk, Act framework. How many of you have taken stop, drop, and roll at any time? Almost everybody, Sage. How many people took stop, drop, and roll and felt like you were ready to be a first responder? Okay, so our Notice, Talk, Act framework is a lot like stop, drop, and roll. How do we notice the signs and symptoms of distress? Once we've noticed the signs and symptoms of distress, how do we have a courageous conversation about that versus a difficult conversation? And then finally, what are the tools, tips, and resources? Even though I don't give the internet service providers a lot of kudos, 988 probably saved my son's life because like well, he was 12, 13 then, but every time he did a search, 988 kept popping up. And he was looking for a YouTube video that was going to tell him how to hurt himself, and he just couldn't get past 988. And he's like, now I'm frustrated. I'm just going to go play Fortnite and give it up. So that probably saved my son's life.
Yeah. And I think, and I'll probably have all of you comment a little bit on this next question. We live in a beautifully diverse community here in Northern Virginia, which also lends itself to substantial socioeconomic diversity, which can lend to greater divides in access to care and access to mental health care, in acknowledging or awareness of what mental health is. We have communities who are first generation living in families where we don't talk about mental health. And I'm wondering, especially with the current climate and even greater uncertainty happening right now, job loss, et cetera, are you seeing any of this show up differently or in ways that are alarming right now? Ellen, you want to take that first?
All right, thank you for that question. First of all, just to ground set a little bit, in Alexandria, I have the largest high school in the state of Virginia. It's almost 5,000 students and 4 campuses. We are very diverse, 118 different countries, 120 plus languages. So when we're talking about mental health and diversity and what that looks like for us, a number of our students, of course, are immigrants, and we're very diverse. So when we're trying to make sure we educate everyone on mental health, a few years ago, we started a social emotional learning initiative. What does that look like? In every school, every day, our students are exposed to lessons that will provide mental health awareness because education is key. But when you're trying to do that in multiple languages, it does present some challenges for us, of course. So we continue to make sure we find ways to not only educate our students, but we found out in that we were training our teachers. But what did that mean? Our teachers also had some traumas that we had to go back and address. And that is something I think that we often don't think about. We're trying to make sure that we are meeting the needs of our students or maybe our patients who are in front of us, but those who are actually delivering the service also need some additional supports because it can also trigger some traumas that they may have had in their past. So it's very important to make sure that when you're doing and having a discussion about mental health and social emotional learning and literacy around mental health, that not only do you train your students and educate your teachers, but you educate your families, your parents, your community members. That's where your partnerships come in. Very, very important, because we do have a number of school partners who provide services, but also we need to remind them of what our needs are. I think, like I said earlier when I started, the conversation would look very different if this was before November. Our families are challenged because they are losing their jobs, they're sending their children to school, their children are experiencing what families are experiencing. So it's not just about making sure now that we welcome students into an inclusive, welcoming, warm culture, but we also have to look to the parents and the families and how we can support them so their children are experiencing school the way it should be. And that means not only addressing mental health. For us, it could mean supporting with jobs, right? Job searches, scholarships, applications, food scarcity. There's so many things that we forget to think about with mental health. We always think about counseling. Of course, we have a telehealth program for our students, for families who can't maybe get to programs during the day or can't get to appointments because they're working more than one job. And so we're offering those telehealth services during the day for our students. We work it into their schedules so they make sure that they do not miss instruction, but they also get the mental health programming and supports that they need. We also offer that for our families now. We do webinars and seminars, and we were speaking earlier about overdoses. We did some wellness training for our staff to make sure they were aware of what to look for in students during the day. And you spoke about the water and the bottles, but really there were snacks being sold that looked like your typical bag of Doritos. I saw a lot of faces pause on that one. It looked like candy, it looked like chips, and it was very hard for us in the K-12 world to tell the difference between a traditional bag of chips and a laced bag of chips. So I think we need to continue to educate ourselves and stay in front of this so that not only are we supporting our children, but we're supporting our families. And that education is key. And alerts, you were talking about searches. Alerts are important. We have tip lines for our students. We have helplines where it's 24-hour access. Our Alexandria Police Department supports us with this. And it's important to be advocates in advance, making sure families and communities know what resources are available for them.
So important, thank you. I think, you raised the topic of the social emotional, all of you, and also the impact of the other things that impact health and mental health, food security or food insecurity, housing security or housing insecurity, two-parent home, single-parent home, no-parent home. And all of those impact our kids and their overall well-being, especially when there's already chaos happening around them. And I really appreciate you raising the light on it's not just the kids, it's the teachers. We at ANOVA talk about putting our oxygen mask on first because we're so used to caring for everybody else, so really paying attention as care providers, how we do that. I'm wondering, with the same token of the great programs you've mentioned, one of the things that I've seen actually really show up successfully with both my kids, and I was surprised because they hated the rule to begin with, is the cell phones away. And it's made a difference in my son's life with how much he uses his phone even post-school. Not my daughter's, she's on TikTok all the time, I own it. But my son's, I'm wondering if you've noticed any benefit other than attention if they're fed, how that cell phone policy has shown up in your schools. Either of you.
I mean, I can just say in one school, the school that I work at, Don Bosco, it made a huge difference. We outlawed them, during school hours. This year, there's conversations actually happening in the hallway, conversations between kids and students and faculty, and conversations amongst kids at lunchtime. So I think it's had a profound impact. I mean, I don't have data that shows changes in that, but just the conversations in the sound in the hallway is just so much more positive.
That's amazing. Just even having to sit and have a conversation with someone at a lunch table instead of sitting on their phones or going to a classroom and sitting by themselves, I can imagine that's huge.
Yeah, I mean, Drew mentioned at the very beginning, you know, Sage, the concept that all young people want to be part of a community. And I think what we're really talking about is how do you get young people to feel like they're part of a community and that they are safe, and that if there is bullying going on online or in the classroom or in the hallway, that the adults will hear that and take immediate steps. You know, that sense of belonging is honestly, I think, what we're all striving for.
Yeah, it's critical to our overall health. Yeah.
Say it again?
It's critical to our overall health.
Yeah, physical and mental health, and that connection, I think, is what, you know, I'm taking notes as you're talking, social emotional thing. I mean, you read about it in the front page of the paper, that's getting criticized.
Yeah.
And that whole approach is being criticized profoundly. But I think, you know, the creation of community and sustaining that is what we're all after.
Yeah.
Were you going to say something?
Yeah.
On that?
I just wanted to add something. I was thinking about when we adopted this as a policy in Alexandria schools, and it is a learning curve. It's a learning curve for students. It's a learning curve for adults. If you think about it, as I was sitting here, I'm watching how many of adults are interacting on their phones currently. So you know it comes with training and education, right? I'm sorry.
That was a call out if anybody got one.
Sorry. And I just didn't call you all out. I actually called out my school board at the time we were adopting the policy. So I'm sorry I'm calling them out again now. But it is a learning curve. You know, I said as we were adopting the policy, I saw someone reach and grab their phone. We have to train, practice, model this for our students because it's very hard. I noticed when we were all down there, we were checking last-minute texts before we came up here and making sure the world is safe. The world will go on without cell phones. And so, yeah. It will, I promise. But when you have a student who's tied to it, I think it's very important to realize that families feel connected to their students. If their child feels unsafe in school, that cell phone gives not only that student some peace, right? It's giving the parents a sense of peace. But what I like to say is that let us be that peace for you in schools. We are here to protect your students. And what does that look like? That looks like if we were to have a true active shooter or an emergency in school, and you are trying to connect with your student, and I'm saying we need to move as a teacher, and you're busy on your phone, something could be missed, and minutes are precious. So when we talk about the cell phone policy, which is a challenge, I know, but it's about safety in schools. And that's a reminder that I think we often don't talk about. Because if we have to move, you're calling, you're having a conversation, your child needs to be quiet in a room so they're unnoticed, that's a safe spot. You have just put that entire classroom in danger.
Yeah.
So when we talk about cell phones, thank you for talking about the socio-emotional piece, the classroom piece, the engagement piece, but the bigger piece of that is around safety.
I agree. And speaking of safety, we have 5 minutes till questions. I want to get a question around substance use and overdose and then gun violence, because I think both of those are contributing to the lack of safety for our kids. So, Mark, I know, at least here in Northern Virginia, I know you're on the other side of the ocean, but we've seen a troubling rise in youth overdoses, particularly involving cocaine and synthetic substances. So what do communities need to understand about this changing landscape, and what have you seen as far as strategies that have been effective to address it or eliminate it?
I mean, I think, you know, at our school and what I've seen across the country over the last 20 years is obviously a huge increase. We saw the data earlier. Again, I don't want to be a one-trick pony here, but the concept of creating community and, you know, having school guidance counselors that are part of the community, that aren't just sitting in their office waiting for a kid to come in there. But we really stress the idea that our students should be their best advocates for themselves. They should be self-advocates. And I mean, you know, we had Red Ribbon Week. We had every day we come together as a community for 10 minutes to gather, to take attendance, to talk about what's going on that day. We weaved the mental health message through that. And we've tried to really weave into that process the concept that everybody's part of the community. And I think when young people feel like they're part of the community, they're not going to bury their nose in the phone. They're not going to vape, smoke pot, whatever it is that the gateway drugs that lead on there. It may sound naive, but I really do think that including the kids as leaders, the meeting we have every day, the convocation we do every day is run by the students. And our counselors tell me now that most of the referrals after a couple of years of this mind change students are making the self-referrals. So kids are taking ownership for themselves and for their future. Obviously involving parents, as you talked about, is super important. But it's this whole community approach that I think will have an impact on drug and alcohol abuse. You know, we heard a couple of minutes ago about there's always going to be drugs and guns available, which is horrible. But if we instill that sense of community, if we have counselors that are involved in grade level meetings that know the teachers and the teachers know them, and that it permeates the building, the kids feel that energy, they feel that sense of safety, and they feel that sense of community. I think that makes a huge difference.
Such a difference.
I don't know if you all agree or disagree with that, or.
Yeah. And
I haven't heard the college perspective.
so I'd love Dr. Washington and to speak to that, and also you're doing some really important things around gun violence awareness and initiatives around that. And I'd love for you to tell us a little bit more about how it's showing up for our young adults, and then what you're doing to address gun violence.
Well, what I can highlight for us is in this region, when we had a couple of young people take their lives by guns, I began to reach out to other presidents. There are about 18 universities in this greater Washington metro area that are truly home, about 120 overall, but about 18 that truly reside here. And we meet as a group, and what I began to learn quietly is that we were seeing increases at virtually all of the institutions in the region. And but nobody was talking about it publicly. We were just kind of dealing with it with our own systems. What that led to was the establishment of what we called the 120 Initiative. I launched that with Darrell Pines to, at that time, 120 young people a year were taking their lives with guns. And so we started that initiative in order to bring together the best minds in the region to come up with strategies of how do you do this in an apolitical way. The reality is the Second Amendment is there, it's real. Political solutions they're just not going to fly in the environment, especially in a state like Virginia. And so we were able to bring those individuals together with those constraints and come up with a series of policy solutions, technology solutions, and solutions in terms of awareness that we believe are helping to change the direction. Now, the data is still new. This first set of solutions only about a year old, and so we're seeing the impact of that in the region. But suffice to say, you put those mechanisms in place, and then you immediately see that the environment around you is changing. What Dr. K. Wyatt highlighted is real. Mm-hmm. We are in a different time, and when you are in a different time, measures that worked previously, for lack of a better way of putting it, seem obsolete.
Yeah.
And so we are adapting, and what we're seeing now is a real spike in the mental health challenges of our young people. And when I say a spike, this is beyond what we were experiencing during COVID. Right. Because of where we're situated at an academic institution where you bring people from all walks of life together, and we're incredibly diverse at George Mason, the 8th most diverse institution in the region, in the country. When you bring all of those individuals together, we first noticed that emotional support animal requests went through the roof.
Yep.
It didn't just increase,
Yep.
they skyrocketed.
Wow.
Our counseling and psychological services became overwhelmed. We had to go to an entity called Timely Care, which offers virtual or online services. If you all haven't done that, I think it's something that you all should be considering. It was incredibly helpful. I see us as being a canary in the coal mine, and so these challenges, if you're not already dealing with them, you will be, because of the additional stress that have now been placed on students through the job losses in their families, due to the changes in their world and their environment, that items that they don't understand are actually real. And as leaders and institutions, we're going to have to deal with those challenges. We're going to have to help those young people deal with them. And so we've been putting in place a series of policies and changes in order to help, policy changes, new initiatives, new programs, in order to help people deal with that. It's truly going to be the major issue that all of us are dealing with this year.
Yeah. So really important what I'm hearing from these amazing panelists. Can we just give them an applause really quick? Is the focus, and we have about 10 minutes for a question, but the focus on really changing our mindset too of mental health is health. That community and belonging is going to be critical and key to the success of this next generation, of all generations, but this next generation. That learning how to interact with our smartphones in ways that are healthy for us and for our kids is important. And similarly, keeping our eyes on the educators, the people taking care of them, while also continuing to speak out and up around gun violence, around what to do when you notice someone struggling, around the utilization of the resources that are out there. And yet, access continues to be a significant barrier. And so one of the questions that's here is accessing youth mental health and behavioral health services in our community is difficult due to cost and limited availability of service providers. And as a provider who takes insurance, we are one of the only in Northern Virginia that will take insurance for psychiatry and mental health, and that's a real challenge. So what if finances are limited, if coverage is limited, what are you and your institutions doing to create greater access, or partnering with those to create greater access?
So Sage, we have promoted the collaborative care model all across the United States for almost a decade. And it hasn't always latched on, but what collaborative care says is it's a unitary one patient. You don't want to treat the brain or the mind and then have somebody else treating the body. And so our pediatricians on the front line are folks that we are promoting, getting better attuned. And so we work with medical societies across the House of Medicine to make sure our pediatricians get better attuned. Our pipeline program that I already talked about, some of those medical students that are in our pipeline program are going to be cardiologists, pediatricians, gynecologists, but now they're thinking about the whole patient when they come to full practice. The other thing we've done is tried to really accelerate normalizing the conversations around mental health, both in school, at work, and in houses of worship. And so we have a Mental Health Care Works campaign, multi-million-dollar multimedia campaign, over 500 million impressions already, medically vetted for paid media, earned media, social media, and owned media. We're sharing insights as we speak with the Ad Council, because the Ad Council has taken notice of the Mental Health Care Works campaign. And then, 1 in 10 people on the planet, Sage, have been diagnosed with depression. And so some of what's happening with substance use is people trying to alter their state. And the challenge is that even as we've normalized mental health, anxiety, depression, and some of the serious mental illnesses, we still look at substance use as a personal failing, as a sin. And so it's still lagging behind. So we have way more work to do to get people help. The other thing we've done is work with law enforcement. So we worked with the DC Office of Attorney General on a campaign called #FutureMeDC. Rachel Gearhart, who helped lead that campaign, is here. This was taking influencers who found a way to get help, but they were younger in age, and talking to folks about what their journeys were like, because what we don't understand about our youth is that the brain is one of the last muscles to develop in the body. Your full brain is not developed until about 25, 26. So some of the decisions that are being made, we're not trying to excuse bad behavior, Soup, but the reality of it is, they don't always understand the consequences of their actions, and then they get too deep, and there's no way to help them.
So I want to turn this to Dr. Washington, and then Dr. K. Wyatt, I have a question specifically for you. When we think about what you raised, and this is connected, around the substance use and how normal it is to drink in college, to smoke pot in college, right? It's very common. What are you doing as a university to educate the difference between sort of safe engagement and when there is a recognizable problem in a young adult where substance use disorder is occurring, or they're drinking to cope with the stressors they're feeling? Is there any programs or things you all are doing as a university?
We have a series of them. And how do I say this? From alcohol to you kind of date yourself when you say pot.
That's okay. That's okay. I'll own it.
He was like, what's pot?
Pot, marijuana.
Exactly. These days, you get cannabis through all sorts of forms.
Yep. Very easily.
A lot of those snacks that you talked about.
Yep.
Are actually laced with cannabis.
Yep.
The Funyuns and the Doritos and the like. We engage our young people constantly about understanding recreational use and management. You got to understand, we're talking to young adults.
Yep.
And where we sit, right? And so they're making adult decisions.
Yep.
And so it's moderation, and it's as long as they're in the legal age, it's moderation, and then it's how do you handle it when it gets to a point where it is a problem, when it's abusive. And from our counseling and psychological services, through a whole host of training, through our individual dorms. But believe it or not, we have on every level of every floor in our dormitories at George Mason University, we actually have kits.
Narcan?
The Narcan kits, so that
that's great.
And we have trained people on each floor, from the RAs on those floors to individual students. All of our organizations, fraternities and sororities have trained individuals in it, and you'll be surprised how much Narcan is being used to reduce overdoses. And so that training program has helped us extraordinarily well.
Yep.
But you really want to reduce it before it gets to that point. That takes me back to the mental health and the scaling of this. Interestingly enough, our students now prefer to use the virtual mental health services because you just can't hire enough physical staff to accommodate the scale. You can't.
Right.
They're just not available. we're kind of shuffling deck chairs on a Titanic with that, right? We hire them from somebody else, and then
They
somebody
go
comes and
somewhere else,
hires,
yep,
and they
yep.
hire them from us.
Yep.
So what we found is, you know, many of our young people, they've grown up digital, right? They're okay with engaging in that way, and then we use our physical folks, our physical presence, for when they really need that one-on-one engagement. And so the majority of our students are dealing with their mental health supports through virtual means, and that is working well. We this past year we expanded it to faculty and staff because we did recognize, as was highlighted, that the folk that need to put their mask on first actually need help too. And so I can't speak highly enough about those services. They are indeed, it's saving lives at George Mason.
Without question, I love that. And last question, I know we have like 15 more questions. I'm sorry, we don't have time to cover them all. One of the questions, Dr. K. Wyatt, and certainly Mr. Shriver, you can answer this as well. As parents, as community members, what are the resources out there that we can call upon to support our youth? And are there resources that will help us have eyes for if somebody is a predator or if somebody is being cyberbullied, what can we do?
That's a tough question because everyone relies on someone else sometimes. I often hear, what is the school going to do? You know, what is our city partners? What are the resources out there? If you don't know, ask. Ask the question, make the call to the school, and we will connect you to resources. We're very fortunate in Alexandria. I know we have some city council members here, and they support us. We have teen wellness centers in our schools. They are in the buildings. We also, I mentioned telehealth. I think, first of all, we need to continue to be advocates to make sure that those resources stay funded. Talk to your legislative representatives and remind them the importance of these programs. If you're a parent, I think what you can do is if you see anything different, whether it's in your child or another child, I get this question often, I don't know what to do if I've noticed it in maybe a neighbor's child. Call the school. Let us be the person who makes the connect. It could save a life. I think too often we waste time on that matter. Don't do that. Be the advocate. If you're wrong, you're wrong. Someone said, well, what if I'm wrong? I had a parent say, what if I'm wrong? If you're wrong, you're wrong. We've still saved a life. So just take the initiative, and I think just be advocates. That's the biggest thing I can ask of everyone in this room today. You don't have to be a superintendent. You don't have to be a teacher. You can just be someone walking down the street who goes and votes and makes sure that our legislative representatives know the value of funding programs like telehealth programs for schools, mental health resources for our city agencies. Those are the things that save lives, and we don't talk about that enough. I also talk about, I get a little emotional about
30 seconds.
That. 30 seconds. Think about, I call this the power of one really quickly. Think about really quickly someone that has touched your life, that has changed your life, or someone's life that you have changed. If you could think about that person really quickly, and you think about who it is, just really quickly do this. Think about a changed life. That's one changed life. We can all do that in 30 seconds. It took us 2 seconds to think about it. It can take you 2 seconds to make a step, to make a change. So thank you.
Thank you. Thank you. Thank you. So thank you again, esteemed panelists, amazing. And they have so much wisdom, and there's so many more questions that we didn't get to, but can we just one more time say thank you?
All right, everybody, we are going to get started with the second half of our conference today. So find your seats. We'll wrap up the conversations because this next section of the conference today is really going to be kind of our push ahead, our look at solutions, our look at how we activate and how we respond to some of the critical issues and that we heard about this morning. While people are still filing in, just kind of take a couple of minutes. One of the nuances, I think, and the challenges about my day-to-day job in telling local news stories is that so many times you get a great interview with somebody who is just so passionate, such an expert and well-spoken on their topic, and I have to figure out how to boil that down to a TV news piece when I really just want to play like a 15-minute interview because it was so insightful. And that's exactly the issue that we ran into when we were producing these, the short video that you saw earlier and another one to come with the students in our area. They had so many insightful things to say, and they wanted to be part of this conversation. And I know we touched on that earlier, but I can't overstate how inspiring it was to, just admire how well thought out their responses were, how well spoken they were, how comfortable they were in kind of diving into some of these issues that we've heard might be actually a little bit more difficult for the adults in this room to talk about. So we're gonna get a little bit more of that right now because we're gonna introduce our next speaker, Morgan Stiller. She was in the video that we played during the introduction there. Morgan is a senior at Robinson Secondary School. She is the founder and president of Rambassadors. While she has yet to begin college, she carries herself with incredible maturity far beyond her years. Please join me in welcoming her to the stage.
Good morning, everyone. Good morning. Thank you for that very lovely introduction. Good morning, everyone. My name is Morgan Stiller. I'm a senior at the Robinson Secondary School, home of the Rams, and the president of a student-led group called Rambassadors. First off, I just want to thank the Community Foundation and everyone here for being a part of something that I care so much about. Every day, I work hard to make sure that students at Robinson feel like they belong and that they're cared for. Today's Shape of the Region conference focuses on important topics that I hear about all the time: diversity, safety, and empowerment. I urge us to build connections and work together as we continue these conversations, finding solutions for a better, more hopeful future. I believe that building connections and working together are essential when it comes to finding solutions. I see it all the time in my experiences within Rambassadors. The mission of Rambassadors is to create a sense of community and belonging for every student at Robinson. Starting out as a military program my 9th grade year, we've expanded in 2025 to over 215 students, now helping all type of students build community and connections within Robinson. Rambassadors work hard to help new students feel connected. When a new student arrives, we give them a tour in a swag bag filled with information that they need to know, kind of like a toolkit, how to get to know Robinson. It answers questions like, how do bell schedules work? What do lunches look like? And who are my counselors? We've noticed that the hardest time for students, however, is lunch. To combat that problem, we've set aside 2 community tables at the beginning of the school year every day for new students and Rambassadors to bond and deepen their connections. But our work doesn't end when the bell rings on their first day. When Rambassadors host breakfasts or lunch, we make sure to invite every single new student. It's a chance for them to meet us and start making close relationships right away. New this year, thanks to a grant from Educate Fairfax, we, the Rambassadors, will be taking new kids to the zoo, giving more time for us to really bond outside of the classroom. But we are not just a sunshine committee. Ms. Selman, the College and Career Specialist, is our faculty sponsor and our Purple Star liaison. She runs the program in a way that challenges and motivates us to bring the Rambassador mission to new heights. Ms. Selman tells us what needs to be done, and we're tasked with finding creative and new ways to accomplish our directives. Because of her leadership, we have built an environment of accountability and communication, which has created a great community among our executive leadership team, our leadership advisory council, and our ambassadors as a whole. Our full day in-person Rambassador training includes presentation topics that cover stuff like, what is small talk and how do I do it? How do I empathize with new student experiences? And how do I set healthy boundaries? Even if we don't end up becoming best friends with students, we make sure to figure out how we can help them. We make sure they know it is okay to not be okay, and to talk to a trusted adult in the school about it. And this year, because our group has grown so strong, we've started mentoring students who may not be new, but who may be struggling still. Because Robinson is such a large and welcoming community, no one has to fight alone. I first joined Rambassadors because I wanted to get more involved in high school. But as time went on, I realized that I loved connecting with students. I loved talking to kids during lunch, and I loved making new friends with them. I loved to talk with parents during football games and discuss new topics with their guardians at military family tailgates, easing their anxieties. It gives me a purpose to be there for others and make sure other people have their community. They will always have a place at Robinson. I wanted to pursue how much further I could create these connections. Each summer, student ambassadors convene at George Mason University, thanks to a partnership between GMU, Virginia Department of Education, and Fairfax County Public Schools. This last summer, I had the absolute pleasure of speaking with Dr. Lisa Coons, the former state superintendent of public instruction for Virginia, about Rambassadors and about our impact on Robinson. This conversation led me to establish the FCPS mentorship program, where me and my secretary, Lena Kim, teach other schools about outreach, fundraising, community building, and expanding influences to other schools across Fairfax County. It's not lost on me that Rambassadors have had privilege when starting our program. We've had full administrative support and financial backing from our principal, PTSO, and faculty. The amount of support we received and are receiving is unique compared to our peers, and we are truly thankful for every ounce. Always looking for new answers, I hope we strive to build more connections and work together to find a solution so that every student in Northern Virginia feels as cared for and feels as special as they do at Robinson. Thank you. Thank you.
Great job. Man, so inspiring to hear that you found that purpose. There's probably people in this room, maybe the guy standing in this podium right, is still looking for purpose, right? And still trying to find what you feel like you have now. So that's incredible. Most of the people in this room will probably be working for you one day. Keep at it. That was fantastic, and it sounds like that work is expanding to more schools. So a lot of kids will benefit from something you've championed. Thank you for that. That's great. We are going to transition now to our next panel. They will be discussing solutions and hope for the future. So please help me in welcoming up our moderator, Megan Mocho, and our speakers, Sandy Chung, Rachel Dean, Master Police Officer Thomas J. Rodriguez, and Holly Motto.
Thank you, Drew. Appreciate that welcome. Hello, everyone. My name is Megan Mocho. I am a partner at Holland & Knight. I have the pleasure of also serving on the board of directors of the Community Foundation. And I joined in that position at the urging of some really wonderful people, but also in order to be part of a solution. I felt like the Community Foundation really does things like today, where we investigate and evaluate what are the problems that we are facing and how can we make those better. So it is a holistic approach to our community, and I'm really proud to be a part of that. I'll be moderating today's panel discussion about solutions. So apropos of my mission here at the Community Foundation, I want to give space to everybody to introduce themselves, and I'm going to go ahead and start with Dr. Jung.
Good morning, everyone. No, it's still morning. So I'm Dr. Sandy Chung. I'm a pediatrician. I am located in Fairfax, Virginia. I'm CEO of a large pediatric group. We have over 1,000 employees in 46 locations in the DMV. I am also past president of the National American Academy of Pediatrics, representing 67,000 pediatricians across the country. I am excited to be here. I am here in my role as medical director of a program called the Virginia Mental Health Access Program, or VMAP, which I'll talk more about, and appreciate all the leaders being in the room talking about such an important topic today. Thank you.
Hi, good morning, everyone. My name is Rachel Dean. I am the Chief Executive Officer at Voices for Virginia's Children. And we are a statewide advocacy nonprofit organization. We focus on public policy solutions to many of the challenges we spoke about this morning. We cover family economic security, early childhood care and education, foster care, and then, of course, health and mental health. And before I joined Voices, I was an attorney for many years. I practiced education law at the Education Law Center, and also spent many years as the director of the Youth Justice Program at the Legal Aid Justice Center. I'm very happy to be here today.
Good morning. I'm Holly Maddow. I am a professor at the Department of Social Work in the College of Public Health at George Mason University. Hey. Yay, social work. I am a licensed clinical social worker as well. Practiced for many years prior to going into academia. I was at actually VCU School of Social Work for 10 years prior to coming to Mason in 2011. My area is in substance use disorders. Specifically looking now in kind of my recent work at digital solutions, so kind of technology for good. We'll talk about a little bit about the limitations of that, but also how can we use technology to help redirect individuals in the moment of dysregulation in ways that help them to regulate in order to connect to what they might need next kind of in the moment. So I can talk a little bit later about some of the innovations that are going on in our labs at Mason. Glad to be here. Thank you.
Good morning. My name is Officer Thomas Rodriguez. I'm with the Manassas City Police Department. My role is very unique. It is focused on kind of a 21st century community policing model. I am the Community Vitality Officer. We've heard community mentioned many times throughout today. And so I bring that community-based solution to our community. I'm very fortunate to work with the Manassas City Police Department. I have worked as a school resource officer for several years. Prior to that role, I was what I refer to as that warrior, right? When you call 911, I was there. The role that I play now is a much different role. The role that I play is what I like to call is presenting that guardian mindset. We need our warriors, as we heard from the superintendent. When we have those active shooter situations in our communities, we need the police and our fire to respond quickly. But when we talk about community, what about that guardian mindset? And so I bring a very unique approach to policing that many of you may not be familiar with. I can't fix tickets. So the gentleman that came up to me and said he got a ticket, I'm sorry. But again, I bring a different perspective because I understand the importance of collaborating. And I don't say that without heart. Collaboration is key. Community was a key word that was referenced today. And so I'm going to build on that as well and talk about some of the programs and initiatives that I created through that community approach. So again, thank you for having me.
Great. We welcome your questions using the QR code. I'll be monitoring it. I might interrupt the panelists if I see a really good one come through, so kudos to you all for adding those. I want to start big picture. So each of our panelists has been really deeply involved in unique ways of reaching and connecting with youth and addressing these issues. So can each of you give me one strategy that you have found to be particularly effective in meeting the students where they are and addressing these issues?
Yeah, I can start. And so, again, as I mentioned, I'm a pediatrician, and I'd love to tell you how I got involved in this work, because when I started in my training in pediatrics, I was seeing, kids with ear infections, doing well visits, all of those things. I've been in practice a couple decades, and that was my day. And so then over the last decade or two, what I saw was gradually, as we got, even before the pandemic, we had more and more young people showing up in our offices asking for help with mental health issues, with anxiety, depression, substance use. When I went through training, and when most of us went through training, we weren't actually taught how to do this work. We were taught how to recognize that a child might need help and then refer to a behavioral health person, refer to psychiatry. But because there weren't enough, and Mental Health in America says that Virginia currently in 2024 at least ranks 38th lowest in the country for the number of mental health providers we have per child. So with that incredible shortage of behavioral health providers, our patients were waiting months and months to get an appointment. In fact, I had a 14-year-old young man, this was in 2017, who had bipolar disorder, and his child psychiatrist here in Northern Virginia retired. And they called us, their pediatrician, to say, the parents called, got an appointment about 4 to 6 months later, and they wanted to know if we could refill his medications while they were waiting. Well, we looked at his medications. He was on 5 different medicines, and there were ones that pediatricians don't typically prescribe. At the same time, Medicaid actually wouldn't pay for them unless a psychiatrist prescribed them. So we said, we can't do that, but what we can do is try to help you get an appointment. So one of my nurses called and got an appointment for him about 4 weeks later. So we thought we were in a good place. During that 4-week period, though, unfortunately, he ran out of his medicines, and we didn't know that was going to happen. When he ran out of his medicines, his disease got out of control, and he got into a fight in the parking lot in Fairfax, and actually near my office. And during that fight, he had a weapon, and he shot and he killed somebody. So that 14-year-old ended up in juvenile justice. That man lost his life. And to me, that could have been prevented somehow, and so there were so many systems issues around that. So that's really how the Virginia Mental Health Access Program began. We started to say, gosh, first of all, those of us taking care of kids today need to know how to do this work. So how do we train primary care providers to recognize anxiety, depression, treat it? But we're not psychiatrists. So when we need help, what do we do? And when I have a question about a heart condition, I can call a cardiologist, and they will pick up the phone right away and advise me on what to do. In fact, they'll see the child often that day or make an appointment the very next day for the child. That doesn't happen in mental health. There just aren't enough mental health providers. So instead, what we set up was a child psychiatry consult line so that anywhere in the state, any primary care provider can pick up the phone and speak to a child psychiatrist or psychologist or licensed social worker within 30 minutes. And so within 30 minutes, any primary care provider in Virginia now can help a family right in front of them. And we also have care navigation resources, because we know we're not therapists. We know we can't provide that ongoing care necessarily. So we also have care navigation sources to help the families find care in their communities. And we're so excited to have this program. And this foundation actually was, and several of you in the audience actually were great supporters of EMAP when we first started in 2017, 2018. And we've just grown exponentially, and it's been fantastic. Thank you.
Thank you. We are at Voices big fans of VMAP. Very glad it exists. At Voices, we approach things from a policy and systems change lens. I am not a clinician, but I can share a little bit about what we are doing at the public policy level, and then the importance of advocacy in youth mental health. We've heard today in the previous panel, and I think we'll hear more today, about school-based mental health integration. And it can look very different from school to school. In fact, in our view, that's the point. School-based mental health services should be uniquely responsive to the communities they are serving, to the school body, to the 120 different countries recognized in a school body. And that is sort of what we have been pushing at the state policy level, which is flexible grant funding from the state to be administered through the Virginia Department of Education and the Department of Behavioral Health and Developmental Services to go to local educational agencies and allow them to craft their own school-based mental health programming. That can look like a variety of things. Our schools here in Virginia use something called the Multi-Tiered Systems of Support, MTSS. There's Tier 1, Tier 2, Tier 3. The supports required and needed get more intense at each tier. Tier 1 looks like, or it can look like a classroom lesson on social emotional learning. My first grader gets those as part of her public school experience. Whereas Tier 3 looks most often like individual therapy sessions with a student on the school premises, usually from a community-based mental health provider. And there are some really interesting public-private partnerships taking place across the state where local child psychiatric providers and mental health providers are able to come into a school setting and meet the needs of those children at school. Those are important because that reduces a lot of barriers for families in accessing those services when otherwise parents might have to take off work, transportation would be a factor, we know waiting lists are a factor. And often those services can be funded through Medicaid, which is a whole other policy discussion. But as public policy advocates at Voices, we also believe it is very important to involve young people in public policy. I think the principal earlier said something about, well, the students are their own best advocates. And we absolutely believe that to be true. We believe that they're the best advocates and really the best experts on their own lives. So at Voices, we have a program called Virginia's Youth in Action. We bring together a cohort of young people, generally ages 16 to 22 or so, to work on identifying the policy issues that are most important to their lives, and then to identify strategies to implement those policies in their local communities and at the state level. Mental health almost always rises to the top as an important issue to our young advocates. But what I think is important, and I don't have clinical evidence of this, but that civic engagement itself, you can find like research on this. Civic engagement itself can enhance mental health experiences, can enhance well-being, and that is because it provides young people with a sense of empowerment and a sense of agency over their own lives. Our young people in our program often tell us, there's so much going on, so much of it feels out of control, but this program gave me the tools I needed to learn how to tell my own story, advocate for myself, and identify the ways that I can create community connections and create those experiences of belonging in a community. So I think that is actually a very interesting and important part of developing mental health and resilience in our young people. It's teaching them to be civically engaged, teaching them to be aware of what's happening in their communities. Thanks.
Yeah, absolutely. So I think there's a few themes. One is widening the circle as much as we can in terms of engaging peer-to-peer supports, in terms of helping families navigate resources for themselves, for their loved ones, for the youth and their families. I'm part of the Center for Advancing Systems Science and Bioengineering Innovations at George Mason. And as part of that, we had an NSF-funded national research training program for 5 years, which engaged a variety of different interdisciplinary graduate research teams. One of the research teams led by, we were faculty mentors, Rebecca Lung and Dylan Scarton, developed an iConnect SUD, substance use disorder app, which can actually be downloaded now as a product free on Android and iOS. And it's used right now by the Chris Atwood Foundation's peer recovery specialists to help families navigate the resources within our communities. It's constantly being updated, of course, with, as resources are being updated. Not so much yet in real time, but those are still developments being worked out. But I think that notion of feeling connected kind of within systems, between and among systems for families and youth is really, really key. Another thing is protective factors. So how many of us have heard of ACEs? Probably all of us, right? Adverse childhood experiences. How many of us have heard of PACEs? Protective and compensatory childhood experiences, or PCEs, protective childhood experiences. Why have we not heard as much about PACEs? Is the research catching up with PACEs as much as it has with ACEs? Meaning we should also focus our efforts on what are those protective influences. Of course, human relationships, social supports, digital technologies that can help us connect, right, in real ways to assistance or other supports in our communities. But what other protective influences are out there that we can help youth connect to and shore up and develop in our programs, in our policies, in our intervention kind of community spaces? And just really quick, I wanted to remind all of us that whole person health is physical health, mental health, which is cognitive, emotional, and spiritual, and social health. That's whole person health. So I did hear early on that there's criticism of emotional, social literacy or something, but that would be like saying, if you break your leg, criticizing the fact that you need help for some kind of physical ailment. So that's a little confusing to me, but just so we kind of move forward with an understanding that all people, right, are defined by these different dimensions of health.
Yeah, so some really great points that I heard from the panelists here, but the part that I heard that resonated with me is the navigation part. And as a law enforcement officer, I'm generally, or my colleagues are the first one on the line where families look for that navigation. Where can I get these resources? And when we give them the standard pamphlet, here, call this number, and the number either doesn't work or no one answers, it creates challenges. And so as a community vitality officer, and the role that I play, I was very specific when we designed this particular program. Again, we took the community policing strategies, but we focused on kind of what we call the core elements. Community, right? We've spoken about community a lot today, and I'm kind of go back to that old Proverbs, it takes a village, right? But who is that village, right? The parent. We cannot forget the parent. The parent plays a key role, and whatever that role of a parent is, it could be a guardian. As law enforcement officers, we're coming into positions now, specifically with the opiate issues, that guardian is now grandparent. That's real, and so that's a challenge. And then the youth. We've heard from many folks about we have to encourage the youth to be part of the solution. And then partnerships, right? So I'm probably the only police officer in this room. If there is one, then you and I are the only. But I'm the only police officer in this room amongst academia and other solution champions. So that being said, some of the programs that I've created strengthens what I believe is that trust between law enforcement and the community, right? And we've had a lot of challenges, right? I'm not here to say that there won't be more challenges. But again, as a law enforcement officer, we're kind of that first call. And so we have to be prepared on how we respond and navigate these systems and that we can help families. And so one of the things that I've focused on is with our youth. I've created programs that are youth outreach. Again, love the fact that we're talking about protective factors, right? Prevention dollars are important. Prevention dollars will save millions of dollars down the line. So again, I've created programs through other collaborations. Cal Ripken Sr., I see that Mr. Shriver left. I'm sure he's an O's fan. Not so much here. But Cal Ripken Sr. Foundation, they have a program called Badges for Baseball. It is a program in which builds those relationships between law enforcement and youth. I've created a multidisciplinary team program within our community called Team Quest Greater Manassas Youth Project, where we bring those experiences, learning through experiences in some of our social economic challenged communities. And then one program that I'm really happy and that I'm really excited about, and I had the opportunity to meet Dr. Bellows at this particular time, is what's called the Parent E3 series. And this was a program where we have to educate our parents as to the risk factors that are out there that are causing our children to be so vulnerable. And we focus on a 3-step pillar there was engage, educate, and empower. If we're engaging our families, and I'm going to talk more about this with the next question and how we do that because it's different. But we got to educate them, and we have to, as was said here, truth is truth, facts are facts. And sometimes we don't want to hear those things because we're afraid. But again, we have to also learn to empower them because again, they have to learn to be their own advocates.
I'm gonna tee you up. Oh yes, very much. I'm going to tee you up, Officer TJ, for the next question. I'm going to go the reverse. But we were talking earlier about diversity and the amount of families in our community that come from immigrants, half of them. And we heard from Dr. Kay Wyatt about how many can be even condensed in a single area, which can make it hard to create a community. So there are cultural stigmas with these with immigrant families from time to time, and there can be fear related to immigration status, the barriers to mental health, beyond the original barriers to mental health, and then just the cultural stigma of even seeking support in the first place. So talk to me a little bit about effective strategies for building trust in that community.
Yeah, so that's a really great question given the current landscape, right? Again, facts are facts, truth is truth. And so families are very scared. I've been in many community forums where when I've done them before, I'd have 20, 30 come to these events. Now I'm having 5 or 10. As was identified in Dr. Bellows' report, 48% of Northern Virginia are living in immigrant families. That's truth. There's nothing, we can't get around that. And so again, as identified, the cultural stigma is that we have to learn how to develop ways to communicate and educate. And so it also starts with ourselves. As police officers, we have to be culturally responsible to our community. I speak to our chief all the time about the importance of living in the community in which we police, right? But as was identified, living in Northern Virginia is not cheap. I was very fortunate that when I started my police law enforcement career many years ago, I don't look it, but thank you. But when I started my career, there was a program that was available that I took advantage of that allowed me the opportunity to live in the city that I policed. It allowed me to raise my child in the school system and then also learn the systems within my community. But it's also important that we educate our officers of that cultural competency, okay? And so as a police officer, we are asked to do many things, wear many hats, and so for training is very important. Community engagement events, we have to be culturally respectful about that as well. Because again, what we see is one event could be different for another community. And then when we do our outreaches, and this is the unique thing that we have done with our Parent E3 programs, is we have to look at it from a multilingual outreach effort. And what I mean by that is our Parent E3 program, I could do it on 2 separate nights. I could do it for my English speakers, and I can do it for my Spanish speakers. But the problem is you're going to get 2 different messages. So why not do it at the same night and provide the necessary technology that's out there? So we offer our Parent E3 program, we offer simultaneous translation. Now, I will tell you, the interpreters don't like it. All right, but again, it's very important that when we talk about community, the community is there at one particular time and we don't separate the message.
I wanted to talk about school support, and I'm going to go to you, Dr. Chung and Rachel, if you don't mind. We're going to address promising models for integrating mental health services in the school system. So talk to me about those.
I can begin. And so one of the wonderful things about VMAP is that when we first started, we started training primary care providers, pediatricians, family doctors, nurse practitioners, PAs. We've trained over 1,500 clinicians in Virginia now at this point with over 23,000 hours of training. So we have trained a lot of primary care providers. And as we went through and remember, we started this before the pandemic. So as we went through the pandemic, obviously there were, if you remember, the ER boarding crises that continues where young people are staying in the emergency rooms for weeks at a time. We decided, okay, let's train emergency room clinicians and help them. And we've done that. Then we thought, oh, let's work on early childhood, because when you recognize that a 3-year-old who's being kicked out of preschool over and over and over needs help, what do we do? And teaching primary care providers, what do you do in that case? Then what we thought was, well, what about schools? You know, what can we do in the school setting? And the school nurses came to us and said, can you help us? We need to know what to do, and we need help. So we have taken the same model, and we are teaching school nurses now all across the Commonwealth and teaching them what to do when a child shows up with that headache or the stomach ache. Is it, you know, a virus, or is it anxiety? You know, what are the phrases that you can use to identify what's going on? How do you screen? How do you then help the child? And so we have been training school nurses now for a couple years, and created a school nurse toolkit, a school mental health toolkit. So it's online, it's free, it's vmap.org. And this toolkit, the school nurses are using to help them learn what to do. And we were talking about it at a conference, and a school nurse came up to us and said, and she was literally in tears. She was like, thank you, thank you so much for this. I needed this. I needed to know what to say to these kids who are coming into my office and my clinic. And remember, a lot of them are not school nurses. Many of them are clinic aides or volunteer parents in many cases. So again, the things that we can do to, like, as you said, it takes a village. And so, training everyone who's around that child as much as we can, I think is just a wonderful approach. And thank you all for the many of you who are doing that work now.
School nurses are so invaluable. We need more funding for more school nurses. We may not all realize that, I think about my public school experience here in Virginia, and, there was a school nurse in every building. That is not true today. There is not a full-time school nurse in every building in Virginia. In Richmond City Public Schools, where my kids go, some of the schools share nurses across the district. We are lucky to have a full-time school nurse in my children's elementary school. And so all school staff are vital for student mental health: counselors, social workers, administrators, teachers. But that school nurse, I think, is doing the most mental health screening out of any staff person in that school. My child has autism, and he has struggled with his mental health. And the school nurse has been his safe place. And I have spoken to her. She's a registered nurse. She says, yes, I am trained in screening for mental health challenges. I know how to identify suicidal ideation in these students. If that were the case, I would immediately refer them to here, here, and here. We have protocols. So just so grateful for school nurses and the vital role they play for health in schools. So that's one model that can be very useful. Another one is co-locating health centers on school grounds. And this is a model that has been very successful in parts of our state that are healthcare deserts. Southwest Virginia, very rural areas are included in that. I was able to visit a co-located health center inside Crimson High School in Petersburg, Virginia last summer. And it is actually in the school. I mean, I had to go in, show my ID, get my sticker, proceed down the hall, and a wing of the school is this health clinic. It is staffed by a pediatrician, a nurse practitioner, and a licensed clinical social worker. And those providers can do basic pediatric care. They can prescribe medication to students, and of course, the social worker there can do counseling, and they take referrals directly from the school. They also treat community members at that site. And I think that can be a very successful and really interesting model as well. I wanted to share, just from the policy angle, there are some innovations being made. The governor signed a bill maybe yesterday, in the last week, that had passed the General Assembly, directing all school boards in the state to create guidelines around telemental health in schools. And so we know that telemental health is happening in some schools. This bill was really aimed at providing more guidance and making sure that schools had set aside space that was secure and private for students to receive those services. The governor also signed a bill that will survey all school divisions in the state about what sort of school-based mental health services they are providing. And that's going to be invaluable data in understanding the landscape as it currently exists, and then how we need to craft and tailor unique school-based mental health solutions at every school, depending on that community and the needs of that student body and its educators.
I love hearing about all of those. There's sort of a recognition that mental health is an emergent issue and that the people on the ground are the ones who are going to be really key to making sure that there's a strategy and a support system for those students. So that's really wonderful to hear. I want to talk about community-based approaches. And so Officer TJ and Rachel, I'm going to go back to you with these questions. You had talked earlier, Officer TJ, about the role of law enforcement officers in supporting mental health and supporting students in need. Can you expand a little bit for us on that?
Yeah, so, again, I really like the fact that we're integrating school-based health centers. We talked about the opiate crisis that we are facing, and the facts are the facts, right? The number of youth that are experimenting and using opiates is shocking, and it's scary. As I was sharing with some individuals during the break, we have some of our adult users that are now seeking fentanyl, which creates a whole nother challenge. And so, though I think it's important to have the mental health component pieces within our schools as school-based health centers, I also think it's important that we identify and address the substance use issues as well. Because again, early intervention and mentorship plays what I believe is that vital role in preventing substance use. And again, by providing that safe, structured alternative to risky behaviors. Because again, when you're involved in substance use, you're going to then become very susceptible to other vulnerable at-risk issues. And so it just continues. It goes to posting inappropriate pictures online because you're looking for that affirmation. It's really challenging aspect. And we talk about bullying. One of the other pieces that my role as a community vitality officer played when we received funding for this position was we also saw coming out of COVID a chronic absenteeism and truancy issue. And so I really like the fact, and it's really not addressed, it's more of a public health perspective, but vaccinations, right? Vaccinations is a key point that sometimes keeps kids out of schools. So again, I don't want to be directed. It seems as though we're paying a lot of attention to schools, right? But again, school is community. I know here in the city of Manassas, we only have one high school. We have one middle school. Everyone's funneled through those locations. And so in the 10 square mile that I have the pleasure of policing, the school is community for a lot of our families. And so, again, I can't speak enough to the preventive aspects. The protective factors are key. And so I'll kind of just stop there because I really want to hear your perspective.
Well, we were talking about community-based approaches to youth safety, and Dr. Hawley, certainly with the opioid use and the epidemic that's going on, the risky behaviors that Officer TJ was talking about, are there other community-based approaches that we should be focusing on to protect the youth?
So I think just kind of premising what substance use disorders is from kind of a neurobiological standpoint just really quickly, which is it's a dysregulating kind condition where the stress system and the reward system in the brain is dysregulated in ways that then create behavioral responses accordingly. So what it might be naturally rewarding to a youth may not then be rewarding to them, their friendships, their peer relationships, drawing, their hobbies, et cetera, kind of diminishes in rewarding value. At the same time, we know adolescence is a time where their emotional, right, kind of responses and reactivity, especially within peer relationships and in high kind of reactive situations, is heightened, and the ability to cognitively problem solve through those situations is decreased, right? So it's really difficult to kind of rationally think through decision making in those kinds of contexts. So you pair substance use and naturally occurring adolescent brain development at the same time, and you have risky behaviors, right? So what do we have to do? We have to expose youth to positive protective influences, identifying what those risks are, but also what are those naturally occurring rewards that could potentially be restored in our prevention programs. So what are the risks and what are rewarding experiences to that youth, personalized to that youth? And sometimes we only focus, right, on the risks because that's like what the outcome is specifically. So I think that our prevention programs that focus on kind of both of those and help youth develop the skills and the tools and the strategies that they need in the moment to regulate in order to move forward without having to rationally think through situations. Are there specific tools or strategies that they can use to kind of pull themselves out of a dysregulating situation enough to make better decisions along the way?
Yeah. One of the questions from the audience is talking about accessing youth where they're at. So they're on social media all the time. My 11-year-old daughter is asking to be on Instagram. So what are we doing to convey this education, the awareness of substance abuse or bullying in social media? Are you guys aware of any strategies out there?
So, and that's a great question, and I think one that everyone is continuing to discuss and work on and think about solutions for. At the American Academy of Pediatrics, we have a center on social media, Center of Excellence on Social Media and Youth Mental Health, where nationally researchers who have come together and talked about what can we do, what works, what doesn't work. We know that many of the algorithms being used are addictive in nature, and so what was interesting as I was talking to a young person, she was a freshman in college, and we were talking about solutions, and all the old people came up with TikTok. We're like, let's do something on TikTok, it'll be great. And she looked at us, and they were like, oh, let's, you can get Dr. Chung to do a TikTok video. And I was just like, yeah. And she was like, what she said was, though, she says, I don't think my algorithm would serve that up to me. Smart girl, right? But she knew. And so I think understanding that sometimes those who need to be educated might be me, in the room, and others like me. But I also think that, engagement of the youth is important, of course, and then how do we understand that they know a lot already. They use it every day. They know a lot. But even if you know a lot, like, I need to lose weight. I know what to do. I just need to do it. And so sometimes it's not knowledge, but it's how do you actually implement it? How do you actually take the information that you're learning and turn it into a practical skill? And so I think as we continue to come up with solutions, coming up with those practical skills, no phones at dinner time, or whatever the actual practical skill is, making sure we teach those is important.
One of our questions that's up next is about, well, how do we close the gaps? How do we make sure that there is access? And there was a great question from the audience about what are we doing to survey the understanding of the populace of their ability to access mental health services. My son has special needs. I went through hoops to try to find support for him. And I'm somebody who has the time and resources to do that, and there's not always that capability. So talk to me about how we can develop those the understanding and the access, either through VMAP, voices, or otherwise?
Yeah, it's a great question. I think, there's so many ways we could go with this. So, sure, I mean, we can talk about, do folks know where to go for access? Is that access culturally respectful? Are the community members, feeling safe if they show up to this place, or are they worried about, their status or ICE being present? Those are all relevant factors. But in my experience, and particularly for my legal practice, when I represented clients and families who were low income or under-resourced, they knew where to go, but there were not enough professionals, not enough locations, not enough available hours to actually obtain the services they were trying to obtain. So I think we have to kind of go upstream to workforce with some of these discussions. We have a shortage of mental health professionals to serve all age groups in Virginia, but particularly children and adolescents. So that is part of the access issue. There was a report by the Joint Legislative Audit and Review Committee that came out about 2.5 years ago about access to services at our community services boards. These are the agencies you can go to in your community for publicly funded mental and behavioral health services. And the wait list in some regions were 6 months long. 6 months for a child or an adolescent? Do you know how much changes in a child's brain in 6 months? I mean, we all do. That is critical time that we are losing. But the conclusion was there's a workforce issue here. We don't have the professionals. So policies to develop that. The General Assembly has talked about student loan repayment options, student loan support to get more folks into the profession, programs at historically Black colleges and universities to increase the diversity of the profession, which is very critical component of access and belonging and the efficacy of those services. So we do need to be looking at the workforce question as an access issue.
Yeah, if I could just take a moment to add to that and completely agree. The workforce piece, well, VMAP is an example of a way to address that. There aren't enough psychiatrists. How do you take the existing workforce of primary care, teach them up enough to help with many of the children, and that frees up those specialists to take care of the kids with the higher level needs. You can do something very similar, and this has been done with therapy and psychology. What we have in our country is a payment issue, though. And so as we think about, taking the students who have gone through all the years of training and have done everything but that last step of licensure, which are clinical hours and are a barrier to find people who will sponsor, who will be that supervisor for you. These people, many of them, we work with so many of them who are incredibly skilled, have years and years of experience in real life taking care of people, but they can't bill insurance because in Virginia, licensure is required. And then if they are, if at some point we get payment for them, the reduction in that rate because of that licensure difference is going to be significant, so that it won't be practical. And because we have so many people, as we know, especially in Northern Virginia, that are in private practice, they can't take insurance even if they wanted to. It's not a viable solution. And so how do we figure out together collectively, especially those policymakers in the room, but all of us are advocates, and being able to speak to our legislators and our insurance companies. If you're a large employer, you're self-employed, making sure your mental health plans and benefit coverages covers all levels of possible care, because not everybody needs a psychiatrist. Not everybody needs all the different levels. Sometimes you just need help getting through your day.
Yeah. Officer TJ, did you have something to add?
Yeah, so I think those are all great questions. And I think the workforce development question is always something that is always up the challenge. But I think we're missing a key component piece, and that's the peer support. I know for my organization as a law enforcement officer, I can go to a peer support person that I trust and have some real life conversations that, as you said, I don't need a psychiatrist or an appointment for. So I think, as was mentioned during the student voice time, she identified that she's that voice for new students. And so we have to look at students to help students. You know, I also facilitate another program within my community when I have free time, which is not much, helping a mobile family resource center. And that family model is important, that we're identifying the importance of finding those in the community that want to help other community members. And so we have a program within our family resource center model of families helping families. And it's amazing when you find that leader who has those lived experiences, those challenges, they take that person under their wing and they just soar. And so again, the peer support piece, and again, the importance of engaging our youth in that peer support. Because again, they're gonna be motivated, they're gonna find their why, and hopefully they'll be the next pediatrician or the next therapist.
Just going to quickly add that we just submitted a grant to help expand the paraprofessional workforce, specifically in kind of crisis work, behavioral health crisis in our communities. And we are proposing 3 different trainee cohorts that will come through over the course of those 4 years. One are high school students, and then BSW, Bachelor of Social Work, undergrad students, and then peer support. So I couldn't agree more, and the evidence in the literature suggests that peer supports in particular are just really important. And I know there's initiatives out there in Northern Virginia to develop youth peer support academy training programs, which I definitely would support as well.
I'll just say that Virginia is part of a national effort to establish youth mental health corps across the country. We will, I believe the timeline is sometime this fall to be launching that, and that is a peer support model. It is bringing young adults into AmeriCorps, training them as peer supporters, and then deploying them into schools, community organizations, agencies across the state, and that has been a fantastic partnership between Serve Virginia, which is the state agency, local philanthropy across Virginia, and national philanthropy with AmeriCorps.
Real quick, peer supports as an engagement lead in crisis response teams has seen a lot of evidence in the literature. So even using peer supports as that initial engagement individual in crisis response out in the community is really promising.
There are 2 questions in here, so we definitely need to get to them. Both of them have to do with resilience. And Officer TJ and I were talking during the break about my family's approach to mental health, which is suck it up and get back on the horse. But there's a bit of a balance that needs to happen between, self-awareness, resilience, and an understanding and having support. And so the question is resilience part of education strategy? And if so, how do you show or teach it? And how do we teach and support youth with building kindness and resilience in the midst of this? Officer TJ, you want to start?
Yeah, so that's a really great question. For us as officers, we focus on officer safety, which is key, right? I want to go home at the end of my shift every night. I have a beautiful wife and a daughter. I'm not sure they find me as beautiful, but hey. But needless to say, there's also a resiliency piece, and that kind of goes to that whole taking care of you, put your mask on first approach. But the other thing with our youth that I think that we don't seem to understand is they lack emotional intelligence because, one, their brain's not formed yet, and they lack the empathy. And I think a lot of it, I'm not going to say because I spend time playing video games myself, but they play video games, and they play games that are pretty violent, right? They get to die, but guess what they get to do? They get to respawn and do it all over again. And so they are hit with so many things that are just not reality. And so they are challenged by what I refer to as emotional intelligence and an empathy issue. And so we have to, and again, though sometimes media hijacks certain terms, the social emotional literacy or learning, that's a key component piece that I think across the board here we can all agree that that is fundamental and foundational.
So one of the things we know with early childhood brain development is that almost 90% of your brain is formed by the time you're 6 years old. And so we really need, as we're thinking about how do we make a dent in this in the long run, is doing interventions much earlier in the course of life and teaching parents how, and caregivers, what skills they need in order to teach their child, when you're 3 years old, 2 years old, 4 years old. So there are lots of evidence-based methods out there, VMAP, word teaching, triple P, there's parent-child interactive therapy. There are all sorts of different types of treatments, or not treatments, but ways of teaching parents. If you are a parent, it would have been nice to get a manual. And if there is such a manual, can we please publish it and, make sure everyone knows what it says? And so again, coming back to the pediatricians and family physicians, we see families very early in life, from the day the baby's born. So there's an opportunity there, I feel like, to continue to have those who interact with our very youngest to learn the skills to help children build resilience. And there's a science behind that, and we can definitely implement it.
I want to pivot to what you're saying about parents, because one of the questions on here is about staying informed. And one of my questions that I wrote down is, how do you educate even the educated, right? But how do you do it in a way that is absorbable and in a way that can be processed and useful as parents or as non-parents, right? There's a lot of people that are being raised by non-parents. And so how are we doing that? Is there anything that you guys can talk to on there?
I mean, yeah, I would also like a manual, and I try to get as much information as I can find every single day to show me how to do this thing called parenting. I think what's important, I think, from my perspective, from the advocacy perspective, is to bring information in a way that is asset-based and empowering. I think as parents, caregivers, non-family caregivers, we exist in a lot of fear. Our young people exist in a lot of fear. And it can be very easy to become consumed by that fear, by that anxiety, by how rapidly our world is changing. And at Voices, we try to take an intentionally intergenerational approach. So we are working directly with young people and their caregivers, and framing things in terms of, here's the assets you already bring to the table. Here's the agency you already have. And I think that narrative shift is very important in prompting the buy-in and the action that we need for multiple generations at once.
And I would just add to the question itself is, if you're the person creating or implementing that program, be vulnerable. I will say that it's important to, you may think you know everything, but you don't know anything until you're actually humbled. And I like that you mentioned the Chris Atwood Foundation. So we have a clinic in our community, and one day in uniform and in my police car, I went up to the van and I tried to introduce myself. I was familiar with the organization. I even brought donuts. I mean, a cop bringing donuts. I mean, that's a win, right? But they were very standoffish and very reserved because, they thought that, I presented a barrier for them. And so I reached out to the director and said, hey, listen, I really scared the crap out of your guys. I can make it up to you. So I went to their office in Fairfax, still in uniform. And rather than me preaching to them and telling them what I wanted to do for them, I heard from them, what do I need to do? How can I educate my colleagues to be better in response to your approach? Because again, we're not necessarily agree they're harm reduction programs, or at least my personal opinion, but again, hearing from them and learning from them says volumes. And again, yes, parents don't get a manual, but again, one of the things is we provide trainings and opportunities to kind of educate us. And they have to be evidence-based. They have to be focused on real data. The report we received today, I mean, I'm going to go home and just digest it, because I think it's important to really take a look at how I can be impactful in a way that is purposeful.
we have a lot of policymakers in the room. You guys have their ear. Without too many minutes, give me the things that need to be changed. What are the barriers that need to be broken?
I stated it before, I'll just restate it. You know, I think that the funding for behavioral health care, not just for behavioral health providers, but all of those supports around it. So the schools, the primary care providers, all the places where kids are, how do we, positive parenting, you know, how do we teach those skills? And we can't do it without resources, and that's just the reality. I think our country just fundamentally needs to invest in children. And how do we do that together and realize that they're 25% of our population, but 100% of the adults of our future? And so how do we, as a group, recognize that and collectively embrace that?
I couldn't agree more on the funding. Is Delegate Siebold here? I thought I heard. Okay, yeah. Okay, so she was the patron of one of the bills I mentioned earlier, and I thought I should mention that so that she, gets our thanks and gratitude for that as well. So I wholeheartedly agree on the funding. I would say with mental and behavioral health, as we continue as a state to grapple with a systems transformation that is so desperately needed, we need to keep in mind that children and youth are not just little adults. It is important that we don't just try to take an adult mental and behavioral health system, particularly the crisis system, and just copy that over, control C, control V, to the youth system. Young people have different needs, their brains are still developing, and we need to be aware of that as we design youth services that are uniquely tailored for youth.
So I would say we need advocates, peer supports, or other kind of supports as individuals are transitioning out of institutional care back to other home environments, whether that's their community, whether they're in a hospital stay and they're going back home, whether they're in a recovery school, of which we have almost now 3 in Virginia, one opening in August, and after months, then now they're going back to their home school, et cetera. Maybe there was a short jail stay, and now they're going back to their communities. Maybe they've been in rehab for a little bit and they're coming back. So I think, what do we do? They are now released, right? They're discharged, and is there continuous support even for those few days? Maybe they have another outpatient program, but maybe there's a discontinuity in care between when they're released and when they start that new program. That's a huge concern because a lot can happen. We need that continuity of care, and it could be paraprofessionals that are providing that continuity of care.
Yeah, so I really like that framework, that continuity, but also collaborative. But I would also say is that we need to meet them where they're at. A lot of times when we do these programs, they're great, but we have to come to you, right? I'm not sure where most of you came from, but I came from Manassas, which is literally less than 20 miles away, and it took me an hour and 15 minutes to get here this morning. All right, as I said, I live in the city of Manassas, and to the police department, it's 1.25 miles, and literally I can run and get there in like 8.5 minutes, all right? But we need to be focused in a way that are real-world strategies that are focused on community engagement. And we also need to make sure they're data-driven insights to those, but also practical and scalable. And so again, as I said, for me, who works in the community, I believe in community-based solutions, and it's important to be in the community because that's where a lot of our clients, the people that we work with, feel the safest. So we have to go to them.
All right, I love action items. Action item number 1, if you have a black Lexus with VLP, go get your car right now before they tow it. Action item number 2, can you all tell us, how can we be a Madison? What can we do? What's one thing that everyone in this room can do if we're going to prioritize something for mental health and youth?
I think it's been highlighted, funding. Funding is critical, but appropriate funding that is focused on evidence-based strategies. And I would also say, again, I've had the ability to work with academia in various roles, both in public health and criminology, and I'm stressing my leaders within my law enforcement profession, that it's important that we look to that, because they have a lot of undergrads that have a lot of time and a lot of graduate students that have a lot of time and do a lot of good writing for that funding.
I would say look at your micro interactions with youth on a daily basis, multiple micro interactions with youth that you are afforded on a daily basis, and what is the nature or characteristic of those micro interactions. And there's a lot of promise in those micro interactions that we have. We can, we might not always be able to kind of determine, we can help guide, but the outcomes or the consequences, but we always have a choice in how we engage, right, with others and with the youth in our lives. And so I think just kind of remembering that and asking ourselves, how do the youth in our life who matter most to us, how do they know they matter in this world? How do they know? How do they know that?
I would say to be civically engaged, go to a school board meeting, go to a city council meeting, meet your delegate or your senator at the state level. Youth well-being is truly a bipartisan issue. And unlike so many other social and economic issues in Virginia and across the country, we do actually see bipartisan work and bipartisan success on issues of youth well-being and youth mental health. So get civically engaged.
Yeah, these are just wonderful pieces of advice. I think one of the things I learned through my VMAP journey was learning how many people are already doing amazing things. And if so many of us in this room are already doing amazing things, then how do we connect our things together to create even more power from that? And so my challenge to you all would be to find someone else in this room who's working on this topic in your region and make a connection, because you may be able to build something incredible together.
And I am not an expert, but I'm going to add one more, and that is to be empathetic and be a good listener, because each of our panelists has been a spectacular listener, either in their community, their professional space, or for children's directly. And I think it's really important that each of us focus on understanding children in your lives, wherever they might be, and listening, having a good empathetic ear for them. So please thank you to our panelists for their great discussion and thoughts. I get to introduce Renee back up here, so thank you.
Hi, everyone, and I know I stand between you and your next engagement, so I'm going to be brief. So I'm Renee Yancey. I'm the president and CEO of the Community Foundation for Northern Virginia, and I want to again thank every single speaker and participant in today's session. Let's give them all a round of applause. So there's a famous saying that says, it's not where you're from, it's how you come. And what you brought here today, whether you were a speaker or a participant, whether you were behind the scenes, you brought energy, you brought ideas, you brought support, and you're exiting with some concrete strategies, hopefully new knowledge, new connections. We're hoping that you met some new folks along the way. We heard about connections throughout our panel discussions. And Morgan, for the record, I would be honored to work for you in the future. Our future is exceptionally bright with you at the lead, so thank you for being here. So there is a survey. We are going to ask you to take a moment to give us some feedback. Let us know how we can do this even better the next year. So I stand here in my role, 1 year into the role. My very first engagement was the Shape of the Region conference a year ago, and my goodness, what a year difference has made meeting new folks, meeting the community, working with this talented team. And we're going away with a couple of action steps. So twice per year, we have made a commitment that we are going to meet with the education foundations. That is work that we are committed to doing, and we have also dedicated funding through our Child and Youth Grant Program about $100,000 in new funding, so we're really proud of those action steps, not just hitting here with research and content and data, but what can we do to use that and to improve our community. I know Drew probably had to jump on the next news session, but I want to thank Drew as our longtime MC and host, and thank the CFNOVA team, every single member of the team, Tara, Sari, Denise, Scott, Jennifer, Moses, Amanda, and Gabby for helping this small but mighty team put this together, and I want to give them a round of applause. Thank you. So as you heard a moment ago at the beginning of this program, this report for Portrait of Children and Youth started with a 2010 report, our first foray into the research space. And it would be an incomplete conversation if I didn't offer a special thanks to the members of the board who were present during that time, because that was a forward-thinking decision. And I'm going to put this person on the spot. I'm going to thank my predecessor, Eileen Ellsworth, who's kind of tucked away over there. It was in the role for 18 years, and it was Eileen's vision to have a research and data center. And I want to thank you, Eileen, for putting that into place. And our early investors, and I'm going to look at one in particular, and I got his permission to quietly say, thank you, Paul Leslie, for being an early believer in this work and investor. And there were others as well, Harry Claff and some others who are more quietly behind the scenes. But I want to thank all of them for helping to make this possible today. And as we leave, thank you. So as we leave this conversation, I'm going to leave you with an African proverb that says, a child not embraced by the village will burn it down to feel its warmth. So they're going to feel our warmth. They're going to feel the commitments. They're going to feel the ideas, the actions that we're all going to take. And I want to final close with giving the final word to our young scholars, our future leaders, for everyone's support of them in advance. And I want to turn to the video, and that will be the conclusion of our program. Thank you all.
I've kind of been, increasingly more and more hopeful for the future.
Make sure everyone feels like how we feel, and how, make sure no one feels that they're alone or can't sit with someone at lunch, or I make sure everyone feels welcome.
For me personally, I think I would definitely come back to Northern Virginia because I think it's such a place that's so diverse and accepting of others and their culture and their background.
What's really the most important to me is I can live in a place where I'm not worrying about how the world is going to react to me just because I'm me.
Continue and do better from where we are. If we can just limit how kids negatively affect each other, I feel like we can have a much more thriving community. We just need to figure out how to put past even our petty differences and come together.